Hey everyone, thanks for joining me for this week's medical sales live stream. Back after a little pause, but we had a good topic to talk to you guys about today. We've had Daniel Madrano on before. Daniel always has cool stuff. He's my go-to guy for anything related to diabetes, especially diabetes diagnostic equipment. And I've actually been out there to see Daniel, seen his whole operation in New Mexico. He's got a nice business going. And I think you guys could really leverage his know-how in the diabetes space to add some value to these primary care practices. Daniel had some updates that he wanted to share with everyone. So, Daniel, I'm gonna just hand it over to you, let you take it away.
I appreciate it. Thanks, Mike. Well, obviously, this is a great idea to be able to help with a lot of the 1099s and maybe even some providers. I know some providers who actually watch this so they can kind of try to see what their best pricing could be. But that being said, I think since we've grown as a company, we want to be able to share that. So, diabetes testing centers really started out about 15 years ago in rural New Mexico, helping primary care providers, and I'd come out of having worked with Johnson and Johnson on their diabetes and diagnostic division, and I'd already felt a passion to help really a lot of the Hispanic population like me, because we didn't really see much. And having worked at Johnson and Johnson, I didn't see anything else other than glucometers and insulin pumps and maybe pharmaceuticals. And so I kind of felt like the fact that my mom was diabetic and she'd go to primary care and they'd kind of send her out to cardiology, neurology, or podiatry was wasted time that hopefully could have been consolidated. And that's the idea. And since we've grown the diabetes testing centers, we've really become more of care clinics. If you're familiar, who is it? CVS pharmacies have their minute clinics, and that's the idea. We've been able to bring in and I'll highlight some of the products and services that we offer that are all reimbursable from a fee for service side of business, which yes means Medicare fee schedules, some of the commercial plans, as well as value-based programs that could come in from ACOs, other things like that. And we make it easy. We try to make it as easy as possible because we're not necessarily looking for reps to go out and sell this and learn as much as they can about this. Of course, it's always a part of it that we're glad, but we're really just looking for customer service, and you will get compensated fairly across the board about 20% for anything and everything that we sell in there. So just looking at the web page, this is also designed for medical providers to do this, see this. We do have flyers that we'll share, but the idea is anything that is diabetes or conditions, chronic conditions that are related to diabetes, which is really cardiovascular, stroke, peripheral neuropathy. It goes to arterial disease, retinopathy, and there's so many other aspects that we have the assessments that are FDA cleared that have access to being able to show that we can actually reduce those opportunities. Number one, in most organizations becomes retinopathy, diabetic retinopathy, because if they identify it early, they can turn that around 95% success ratio, followed by maybe neuropathy or arterial disease at about 85. And all of these are significant numbers. But what, again, we're trying to do is we were picked up by a group purchasing organization, which, and this is real, has over 20,000 clinics in the United States. They are the largest private group purchasing organization. And what we want to be able to do is we want to be able to share with any of your listeners, any 1099s, and actually give them the territories for which they cover. So it doesn't matter anywhere in the United States. We will gladly share the addresses and the names of the clinics so that they can go and earn business. So now it's not necessarily cold calling. At least there's more of a targeted base, and that's what the group purchasing organization wants to be able to do is bring this to their customers or their clients. And we're more than happy to do that, which means we're more than happy to help a lot of the independent reps start their own businesses or actually increase, or they can have more reps themselves. We'll provide the products. All they ever really have to do is let us do the training. They just schedule with the clinics and we'll take it from there. They can gladly listen into these because these are their clients. We respect whatever the products or services that they bring in. Now, understanding we have different products and services, which I want to highlight. And they're not just any types of products and services. Most of these are very unique in the industry. So, us bringing something as a value add in the technology makes these very special. So, good example is we have the first AI neuropathy device, and this will actually be able to show this is cloud-based, it's wireless, it has a monofilament, it does vibrations, temperatures, and infrared thermography. So it's m multiple AI reporting that comes out that makes this unique. The AI fundus camera, we said this is the number one target. And this is the first time that there is a handheld device that doesn't need to go to a specialist because this is FDA cleared, just came out late April this year, that within less than 60 seconds, you could take the images and it will actually tell you whether the patient has retinopathy or any other eye disease. And that's kind of it. From now on, it's portable and no need for specialists. We also have a unique cognitive assessment. This is a medical device. Sometimes there's a lot of software out in the industry that uses software for cognitive assessments. I would urge a lot of people to pay attention, make sure that it is FDA cleared or FDA registered. There are some softwares that are not, and nobody wants to be caught promoting a product that the insurance or CMS can come back and claw that money back because it didn't have an FDA clearance. So we take all those scenarios into consideration to make sure that we're dealing with real products that have gone through FDA. And so aside from just the actual hardware device, we do have access to software. Software is just easier for some of the telemedicine, but this is it. And most of these products are very unique to us exclusively, which means you don't have to shop for products. I think in Shark Tank, they always talk about, are you a product or are you a company? Well, we're a company with multiple products, and we're glad to share those again with the independent reps or established distributors who want to be able to do this. And I'll kind of there are more products, but some of the new things that are going to be coming out, remote services like chronic care management and RPM. The new part of for 2025 is they're getting rid of the 20-minute time limit that was usually needed, which was pretty tough to be able to talk to patients and achieve that for, I think it's $35 a month on average. We have a turnkey process that will be handled by a third party. This is a really reliable company that we've worked with. And the benefits become they do everything for you. So for the medical providers, and if you have really good relationships, this is something that they will never do themselves. They don't have time. They don't have staff to be able to do this, but we do. And so we bring this as a service that's done on the back end. And so this becomes another value add that they're generating revenue for any of those patients who have chronic conditions, right? It could be diabetes, it could be obesity, it could be hypertension. Why we became diabetes testing centers is because a person living with diabetes already has 3 to 4 of those chronic conditions already. So instead of just finding somebody who's hypertensive and maybe overweight, if you find a person that's diabetic, might be on cardiovascular medications, ACE inhibitors, beta blockers, channel blockers, you name it. That's why we focus here to be able to bring all of these services and more, because we also show that we provide therapies. So some of the therapies you guys may already be doing, we're not here to compete with you. We want to be able to utilize your products with what we're bringing to the market. So, Mike, I think you're a good example. You promote the GLP-1 therapy. We're not. We're really going to be more on the assessments that are going to contribute to the GLP therapy, right? That way, everybody has their own reserve space. The relationships, that way the messages that everybody's been doing and talking about remains yours. But now all of a sudden, you can come back and talk about the fact that you have one source that will provide not just one product, but we can embed everything that we have and make that clinic a subspecialty with a care clinic. And we've been doing this again 15 years. We think it's really simple. We figured it out. We're a billing company as well, so we make sure that the clinics that you guys find are able to capture the best reimbursements and understand the billing, because some billing codes get confusing to clinics, especially if they're mom and pop clinics where they might have the wife or family member doing the billing. We step in, make sure they're successful, and they generate the revenue for doing the right things. So, in a nutshell, that's kind of what our focus is.
So you guys will basically just fill in for whatever they need to round out a diabetes testing and treatment center.
Yeah, that's really as simply as it could be stated. That's true.
Okay, cool. And how does it work with commissions? I guess it's equipment, so I mean you're going to get
Yeah.
paid based on what you sell. So there's not like a set commission.
Well, what we try to do is pay very fairly across the board. Yes, we will give the opportunity for some equipment to be sold, right? And if we're talking like some of those value-based or some of the other ACOs, they don't necessarily buy the equipment. They want to be able to rent it. So we're going to offer some of the equipment, the option to be rented, and it should be 20% across every product and service that we have. Again, there are different prices for different products. So the commissions are going to be fluctuating between the purchase price on those items, but it'll be very clear. Everybody knows what that's going to be, and it just makes good business sense for us to pay out the reps who introduce us to a clinic because it's their business, it's their client and their relationship, and we need them there to still be able to talk to them, pop their head in. But this is a great way to be able to allow them to generate money every month if they take in one product to a clinic or a friend, fantastic. But if they have a really great relationship, then the benefit becomes that they can add more products to truly become a diabetes testing center or a care clinic that really caters toward that patient or pre-diabetic patient population. Because now they become specialized. And every clinic, as much as their primary care, they're going to want to do weight loss. Well, guess what? A diabetes testing center or a care clinic does exactly that. If they've been doing neuropathy pain clinics, guess what? A diabetes testing center does that. So all things related really fall under our umbrella. But more than that, it actually opens up opportunities that, hey, maybe this neuropathy is a little slow around the wintertime. What else can we do? Well, we can consult and talk to them about the fact that maybe the remote management, the remote care is something to consider because that's 24/7, 365. There's always going to be somebody to take care of those patients that they may not even see. And maybe some other things that our products and services are non-invasive and highly reimbursable. So we kind of want to nail it, again, having done it right.
How's the rep find out more, or how do they market this? Are they just using your website, or do you have something for them to know what it is that they're pitching?
Yeah. So firstly, they have to establish themselves with us, let us know who they are, where they are, because then we want to be able to share our list of 20,000 clinics throughout the country. If somebody calls on, let's say, West Texas, then we're going to share that territory for West Texas. Somebody calls on, they're going to say West Texas and Houston and San Antonio. Okay, fine. We'll share that list. Maybe we just give them all the contacts for Texas. So that way there's no questions asked. You will see us give the opportunity first because we want to show what we're putting forward to make these individuals, 1099 and sales reps, successful. So if somebody covers two states, just show us valid proof. We don't want to necessarily eliminate the opportunity from somebody else who really works in a territory in that area. Somebody might just focus better in Dallas, or they might focus better in San Diego or New Jersey, whatever that is. We, as
Right.
soon as we know who they are, they sign an agreement with us. We will protect them
And
in those territories and share
you
who
have some
those.
marketing for them, though?
Yeah,
That's what
of
I'm
course.
getting. Okay.
Yeah, of
So,
course.
and then in terms of the sales cycle, are they just brokering a meeting or a call with
Yeah,
you and your team to
yeah,
get
that's
the
right.
deal closed?
Yeah, we're looking more for, we want them to work less and earn more than they would with other products and services where they have to be trained. They have to know what do's and don'ts are going to be involved. us. We just want them to introduce us to a client who may be interested in one of the products or services that we introduce. So that way, hopefully, we can open up those opportunities and help them. But that's all it is you're right. It's just introducing us to somebody, brokering them with that relationship, and then allowing us to close the deal. And that way they can start capturing the commissions.
Cool. All right. Well, keep your eyes and ears peeled when you hear diabetes, and I know you guys will. It ain't going anywhere. A lot of diabetic people. And if you're looking for an in, I mean, to have something good to offer in the diabetes space, you're always going to have ears that are willing to listen to that. So I'd encourage you to reach out to Daniel. His contact info was up there on the screen just a moment ago. Just reach out to him, ask for a contract, and he'll get you guys going. Daniel, thanks for joining me.
Yeah, appreciate you, Mike. Thanks.